Did you know that Alzheimer's is the most common form of dementia? Alzheimer's affects everyone differently, whether it's a parent that has it, a grandparent, or a friend. It's important to know the recovery process for everyone because everyone's different. Today I'll tell you about the causes, symptoms, effects, and possible treatments for Alzheimer's. There are 3 causes of Alzheimer's disease: genetic, physical, and environmental. Genetic is through family history, and if a parent has Alzheimer's, there's a 50% chance that their child will have it, according to WebMD. Genetic mutation is the reason that Alzheimer's is hereditary. There are 2 types of Alzheimer's: early-onset Alzheimer's and late-onset Alzheimer's. Early-onset Alzheimer's is really rare, and it starts happening between your 30s and 60s, and then late-onset Alzheimer's starts happening around your 60s or older. There are physical causes of Alzheimer's as well. Physical symptoms progress slowly, and there are longer lasting effects on the brain. It starts with your nerve cell damage, and that can prevent the brain from delivering signals and also cause memory loss. And there are some environmental causes such as smoking, not exercising, and no social interaction, but further studies need to be taken for environmental causes. There are also many symptoms for Alzheimer's disease. They vary, and they're divided into 4 categories: behavioral, physical, cognitive, and psychosocial. Behavioral symptoms include hindering social skills, needing help with simple tasks that you could do by yourself before, losing things frequently, and getting lost in places that were once really familiar. Physical symptoms include loss of balance, weight loss, dizziness, and impaired motor functions. Cognitive symptoms include confusion, lacking focus, not recognizing people that you really knew before, and even hallucinations. Psychical symptoms include mood swings, personality changes, being easily agitated, and even paranoia. Alzheimer's is a degenerative disease, and so the symptoms just get worse and worse. Eventually, you will not be able to do simple tasks, and you'll have a high temper and a drastic change in your personality. You'll want to be isolated from your family and friends, and you'll have permanent memory loss and not recognize people that you knew before or places that you could be familiar with. There are other disorders that piggyback off of Alzheimer's disease. These include anxiety, depression, and PTSD. As for the treatment of Alzheimer's, there's no cure to stop the progression, but there are some drug and non-drugs that you could try. There are 5 drugs approved by the FDA that you could use to slow the progression of Alzheimer's, and there are 5 non-drugs treatments that you could also try, such as memory trainings and physical exercise programs. Overall, it's important to know the causes and symptoms, effects, and treatments of Alzheimer's. Alzheimer's affects everyone differently, so it's important to know everything about Alzheimer's so you are prepared.